Autism was just getting to be defined when I started practice. Parents weren't aware of it. No, medical community was becoming aware of it. Psychiatric care was trying to figure out where they fit in all of that.
Well, I think most people looked at it as a disease, a medical disease, and I think they didn't know much about these kids, certainly.
Well, I think at that point, with the idea of 4 to 5 and 10,000, it was hardly on your radar screen. And at least in an urban area, that would be a specialty thing, for sure. And you might or might not provide primary care for individuals with developmental disabilities as a family practitioner.
For all that period between the early 80s and the mid 90s, it was still considered a quite rare disorder and was hard to distinguish from what was then called mental retardation, or now known as intellectual disability.
That was a devastating diagnosis 30, 40 years ago. People felt that their family life was over, and very often their family did not survive the diagnosis and the trials of dealing with it. It just broke families apart all the time.
It was definitely a medical model that people would think of when they thought of autism. And I think that they were looking for some medical treatments and maybe medication. And I think over a period of time, people realized that there was much more to it, that there are other dimensions to it, including social and mental health.
Parents came in and they heard the diagnosis of autism. It was terrifying, and early on. I mean, just really, almost you wanted to avoid using the term because you couldn't really define it, and you really didn't have an answer for it.
Well, when I started practicing medicine, autism was an oddity. It was something you didn't expect to see, something you weren't looking for, and something you weren't trained to deal with. And as time went by, you became much more facile in dealing with it, to the point where you really actually began to think every once in a while that you were helping your patients in the community by dealing with it directly. And it was a slow, informal process, but it worked.
I think that there were a lot of reasons why providers were reluctant to see kids with autism, because at the same time that you're describing it, the pressures to change the way primary care practice.
I think that many doctors felt like they themselves couldn't provide any particular service, and it's very time consuming to see these children and the families, and you spend a lot of time with them, and then you feel like they walk out the door and you haven't done anything for them. There's not very much reward.
So the way I view it is autism always existed. It wasn't any different. We've become different over time.
I'm grateful that it's now more accepted among medical professionals and parents that this is a problem we can deal with, that we have tools for it, that we can continue to work with these families, and I expect that to progress over time.
This is a disorder that requires close cooperation with schools, with speech therapists, with physical therapists, with occupational therapists, with psychologists, at all levels.
Because families need informed support in a holistic way, both in terms of understanding the best treatments that are out there, the realities of what is available, and how you get it in your local region.
I think the goal would be to integrate mental health care and developmental disability care into primary care. Again, I think we need to look beyond a medical model for taking care of these kids. And we need to try to integrate as many services as we can into primary care.
The language used in an appointment, it's incredibly important to be empathetic and live that moment with that person rather than pontificate.
That they don't have to be able to provide treatment in order to be able to provide a service to a family when they can make diagnoses and make recommendations for referrals.